Hello everyone. March being colorectal cancer awareness month, we'll be seeing a series of videos regarding colorectal cancers. In this, we'll be discussing about causes and symptoms of colorectal cancer. So, what can cause colorectal cancer? It can run in families, genetic. Proportion of colorectal cancer happens due to something called as hereditary non-polyposis colorectal syndrome, cancer syndrome, familial adenomatous polyposis, and few other non-named syndromes. Syndromes means a group of manifestations of a particular genetic problem. So this compromise only about 5% of the colorectal malignancies. Remaining 95% is caused by alteration in the lifestyle, mainly because of food. Eating lots of unhealthy food which is energy dense, particularly high fat, which are very less in fibers. Taking very less of fruits and vegetables is a very important cause. Also having red meat. So these are the dietary causes for colorectal cancers. Now the other lifestyle causes for colorectal cancers include consumption of tobacco and excessive consumption of alcohol. Everything ultimately culminate towards one being or getting obese. So obesity is also another subtle cause for colorectal cancers. So can run in families, genetic, due to diet, red meat, energy dense feeds like high in fat for a very long time, very less of fibers, very less of fruits and vegetables, excessive consumption of alcohol, smoking and obesities are all causes for colorectal cancers. Now what are the symptoms which one can develop which can make them suspect that whether one can have colorectal cancer or what? So first and foremost is the alteration in bowel habits. So what does that mean? So for example, one may routinely pass stools once a day or twice a day or once in 2 days or something. If this gets changed, for example, if one who is passing once a day, suddenly he is passing 5 or 6 times a day, or suddenly he is passing only once in 3 days, then it's very important thing. Particularly when this happens without any inciting factor, like we have not traveled outside, we are having a regular feed, we have crossed 50 years of age. All these are like slight alteration in our bowel habits which is prolonging without any inciting factor is an important symptom. So next is weakness. Weakness may be due to anemia, like over a prolonged period of time, small amount of blood is getting lost in stools because of cancer. So that over a period of time can lead to anemia. So in an elderly male who has anemia, one has to rule out colorectal cancers. The other symptoms include loss of appetite and undocumented or unexplained loss of weight. So symptoms include alteration in the bowel habits, anemia causing weakness, fatigue, undocumented or unexplained weight loss, loss of appetite. Few rectal cancers like cancers which occur just above the anal canal can present with symptoms like fresh bleeding, sense of incomplete evacuation of stools or excessive urgency. So all these are like rectal cancer symptoms. So if one has these symptoms, particularly in an elderly male, it's prudent to get ourselves examined with a physician, get all those tests which they tell. If it is early, near cure is possible. So the treatment modalities available for colorectal cancers include surgery, which is the main stay of treatment, and adjunctive chemotherapy and radiotherapy, which can be given either before or after surgery. Thank you.